Hello, my name is Demi, and today I will be giving a demonstration for the Visician VR controllers. These are a set of 3 controllers that closely emulate the instruments that real surgeons and clinicians use. These aim to make virtual simulations of medical procedures more accurate and precise, improving the accuracy of medical education. Today, we will be using the hinge controller, which emulates tools such as the tweezers and forceps, and the stylus controller, which emulates tools such as the scalpel and electrocautery pin. To start, we need to calibrate our tools. Each tool has colored tape at the tip that will indicate to your laptop webcam where the tool is in space. I will hold this closer to the camera, click on it to track it. The little white circle on my pen and in the viewport indicates to me where I'm holding the pen. I will do the same with the hinge tool. I'll calibrate one stylus tip and then the other. Perfect. And now my tweezer tool is shown in the viewport. Now we can start with our procedure. The procedure we'll be performing today is a sebaceous cyst excision performed on the back of this patient here. This demo has 2 different states, a more graphic state, currently shown, or a more censored cartoonish state. This is so that you can provide this demonstration for different audiences, whether they are a surgeon, medical student in training, or whether they're just part of the general public and want a better view of what's going on without having to look at something so graphic. For the sake of this demonstration, since it is relatively tame, we will keep it on the graphic setting. You will first follow the instruction on the left sidebar. Because we are making an incision, we will be using this tool right here, which will emulate a scalpel. By holding this tool up, you can see in the viewport where the white circle is, tracks the stylus tool. You can hold down the spacebar button to make an incision, like so. As you can see, I have made my incision slightly too large, but that's okay because I can press the clear button right here to reset my work for this step. This shows how useful it is to have virtual simulations for medical procedures because students can practice a procedure as many times as they want until they feel proficient enough to do this in real life. So for the next attempt, I will be much more careful. I will bring my stylus closer. There, that looks good. Once you're happy with your work for a step, you can press the next button and move on to the next step. Now that we've made an incision over the cyst, we need to drain the sebaceous tissue inside. For this, we will use the tweezer tool to grasp the cyst and pull it out of the skin. By pinching the tweezers together, you can grab the cyst. I will do that. Just as with the incision step, if you mess up and do something that you aren't satisfied with, you can press the clear button to reset your progress for that step. I will grab the cyst and carefully move it onto the tray. Good. Once you're happy with your work for this step, again, you can press next. Now we need to suture the wound closed. Again, you will use this tool this time as a needle, and you will hold the spacebar to make small horizontal stitches over the incision. Once you are satisfied with your work, you can press next. Now you are at the final step. This button right here is the calibration. If at any time throughout the procedure you feel the need to recalibrate your tools, you can do that by pressing this button. And again, this is the safety toggle, so you can toggle a different version of the graphics if necessary. But once you are happy with your work, feel free to press the next button and you will be done with your demonstration. Thank you for watching.